Hi, good morning, Dr. Sona.
Good
Wel-
morning, Poshni.
Welcome to the Indian Metabolic Health Conference.
Thank
Uh,
you.
to give our audience a short description and, just to let our audience know who Dr. Sona is, she's a board certified internal medicine and endocrinologist. She's the fellow of the American College of Physicians and fellow of the American College of Endocrinology. Dr. Sona Abraham is not your typical endocrinologist. She's a really dynamic, a compassionate medical professional with profound interest in the intersection of science and emotion, human behavior, and the profound impact on our emotional and mental wellness. She herself follows a low carb lifestyle and is working with her kids as well to incorporate the same. Welcome, doctor.
Thank you so much, Poshni. And as I said, it's fun to kind of talk to you because we've shared patients, and that's something that, gives me a great pleasure to kind of chat with you about the same things that we both hold so close.
So true. Why don't you tell us a little about yourself, more about yourself?
Well, not much to say except I've been all over the place. I grew up in Calcutta and Delhi, finished school till 12th in Delhi, did my med school from Trivandrum Medical College, then went to the US, did my residency in internal medicine and my endocrinology fellowship from University of Maryland, Baltimore. Then moved to Delhi, was there in Delhi for about 10 years, headed the endocrinology department at Batra Hospital. Then moved to Kochi about 5 years ago, and I've been here since.
Wonderful. And how did you get interested into low carb diets and incorporate?
Okay. See, fortunately, a large bunch of my patients over the last 10, 15 years have largely been middle class patients, lower middle class patients. And something that I'm very passionate about is cost of care. And so to be able to give most bang for the buck for my patient. And the cost of medications, the cost of interventions not done right at the right time has a huge payout, not just financial, but mental, emotional, physical to caregivers. And that is why I believe that the best way is to start with the diet. And that's the easiest because I personally feel, we are all overwhelmed with a lot of things on our plate as doctors, as anybody for that matter, my patients, whether they work or they don't work, be they homemakers, people assume that they have nothing to do, but they're slogging their butts off from morning to night thanklessly. And most of the homemakers I know have no time to breathe, so I can tell them go to the gym, go do this, go do that, but there is only going to be so much that they can practically do. They can be active, but that's only going to be so much. So the easiest is really the diet. It's the lowest, cheapest, fastest, most effective bang for the buck option, and that is how I got interested in low carb, and I've been doing that in my own way. But I think having teamed up with you guys over time and learning a lot from you guys and your experiences, sharing my experiences, I think we've all grown a lot together as a community. I think so. That's been terribly helpful.
Absolutely. I mean, as you rightly said, and I think I would like you to repeat it through the session sometime that diet is the easiest aspect that one could immediately work upon. So, what I know you mentioned a little bit of what kind of people that you're seeing. What is the chronic health situation like? Give us some insight on what you see.
See, the problem with the chronic health situation is most people in India, at least, maybe even to some degree globally also, um, seek attention only when things are about to, explode. And that's a little too late. And by that time, why that's when they present to us as doctors. They're usually either having renal failure, or they're having a heart attack, or they're getting a bypass surgery, or they're having a foot cut off, or they're having that point at which maybe that's not the best time to have a conversation about diet, because they can barely eat. They're maybe they're going to be dead tomorrow. So that's unfortunately too late to have that conversation, which is why and the practical reality is India, probably a huge part of India is middle class, lower middle class, poor, and carbs are cheap. And because carbs are cheap, what's happened in the US is now happening in India. Back in when I was in training in the US, what used to happen was obesity was exploding. And diabetes, not so much. Diabetes in the US is sort of far lower in incidence than the incidence of obesity. And that's again genetic heterogeneity. And in Indians, we are genetically more predisposed to diabetes. We are getting diabetes far earlier than we get obese. And unfortunately, what is obese is not visible in us Indians. We are typically much leaner, we are viscerally fat, and our personal fat thresholds are much lower than the Western population. And that is why people fly under the radar. And typically culture has carbs as our staple. So comfort foods and everything is carbs. Cost of food. So the cheapest, what's available on the roadside, what's available in our homes, the good food, not junk food, is all still carbs. And we have created an environment where we say, okay, fat is going to cause you cholesterol, eggs are going to kill you, non-veg is not good for you. So then what do people eat? So that is where I think we are ending up with this explosion of metabolic health disease. And we are going to see a bigger impact in the next 5 years. We are going to see young kids in the 20s and teens with cirrhosis. We are going to see, chronic health diseases, and we'll have strokes in the 30s, and we'll think what happened. And I think it's time to start doing something is right now in our homes.
You touched upon what is so close to our heart together. I mean, the reason we connected so well is just that childhood obesity is something that we see so many incidences. You did even send across. Tell us more about that, because I think that is a huge concern for all our viewers and even for us as practitioners to understand what it is that we can also do to subside that.
See, I think kids are really smart. I have 2 teenage boys. Okay. And what I've realized, and this has been something that's been on my mind, if I cannot influence my own kids, how can I influence my patients? And I believe teaching has to start from the home and outwards. And it has to start with me. When I make certain choices, when I do things different from what they are used to seeing, what my parents might tell them, they question, and then I have to explain why I'm saying. And very recently, my oldest son, he was like, you know what, in school, but they talk about this food pyramid which says you should eat more carbs. Even at school, when I lean into more chicken and eat very little roti or rice, everybody tells me, you should eat rice or eat more roti. That's the healthy thing to eat, and not eat so much non-veg. And he's like, no, my mom told me that's not the way to go. And I said, don't believe me. Do one thing. Here's a measuring tape. Here's the weighing balance. Let's do an experiment. So starting June, they started their own experiment. They stopped eating biscuits and chips and cold drinks and juice. And, they still have, their bread or things but in much more of a very conscious way. They're aware. They immediately go on the scale, they have a breakout, they have acne, they immediately say, okay, I had sugar. And that is probably, so I'm just saying they're making their own inferences, they're thinking for themselves, they've seen their weight go down there, and people complimenting them, and their friends talking about, so the teenagers are now starting to talk about protein and carbs and stuff in school. The parents and the teachers are the ones, and the doctors are not the ones who seem to be on the same page. They're getting there. I think in the endocrine community, we're getting there. In the cardiology community, we're starting to get there. But I have a terrible time, say, even in my hospital, with doctors not understanding this, because they just believe that, no, nothing's going to happen. I see them, guzzle juice and...
That must create some interesting conversations at work as well.
They do. They think I'm crazy, so it does.
Welcome to the crazy conference then. So how did you, I'm okay, I'm deviating a little bit, but how did you influence your children? Because I think our audience would really like to hear that. Two things, right? Teenagers, can't talk to them, can't influence them, and here you are saying that you can, and that too on diet, because right now teenagers are the ones that we see having the maximum amount of junk food. And maybe also touch upon
See,
why it's important that they are aware of these things.
so the two-part question, I think it's maybe a little easier for me as a doctor, as an endocrinologist, to talk to them, because what I believe, the medium for change is through storytelling. And I believe, so what happens to me is every time I see a case which I think has some ramifications, where I can spark a conversations, things which I speak on Twitter about, I share with them. And it's my dinner time conversations. You know what, I saw this patient and this is what happened, this, and so they ask me questions, we talk about. So to the point that my younger son thinks that I am a stress doc. All I do is help manage. I'm a therapist, so that is what he thinks. So, but that leads to a lot of interesting conversations about, what should you do? What would you do if you were in their place? How would we have prevented this? How did this patient end up here? What could have been done? So when you make it into thinking questions, see, parents typically, especially with teenagers, you tell them, do this, don't do that. The fastest way to get a rebel.
Yes.
Some may not speak up because you're, an authoritative parent, so they're going to shut down. Some will rebel outright and become like the defiant child. And both of these show that we are doing something wrong with our parenting. When we get kids to think, when we ask questions, when you respect them, when you listen to them, when you have conversations, I think, and for that, we need to be emotionally available.
Wow.
Most parents are super stressed.
Yes.
They have no time.
Yes.
They don't have time to process their own thoughts, their own emotions. They're racing from one thing to the other, this thing, this meeting, that thing, this, even doctors. And that's what I was having a conversation this morning with my colleagues, other endocrinologists, that where do we have the time to breathe? Are we making that time to breathe intentional so that we are there physically present with our families, but are we mentally and emotionally available?
And probably the parents are battling their own metabolic issues as well.
They are. So I think change starts from us. Now, every time we move the needle back in, am I managing my stress right? Am I managing things on my plate right? Am I setting the right example, not just in my words, but in my actions? I think actions to kids speak louder than words. How am I with my colleagues? How am I with my people, my friends? Am I valuing? And I think relationships is a huge part of lifestyle per se, and I think we don't emphasize that enough.
Yeah, we absolutely, we don't see the time taken out for emotional and mental well-being, either by parents or being taught to the children. Is there any research or article that you have read or that you find really fascinating, especially in the field of endocrinology, that connects low carb diet that you're looking forward to?
Not directly, except maybe Dr. Chris Palmer's work with in terms of brain energy. I mean, I've a lot of work about that Dr. Chris has done. I've got his book, and I had my senior read through that, and he loved the book. And I come from a different lens too, which is my passion area. That is talks. It's about early childhood trauma and how that sort of changes the software in our brains, so to say. It puts in a lot of Trojan viruses into our brain, which cause us to sort of get emotionally triggered, and we become reactive. Every time we are reactive, we lose our impulse control. When we lose impulse control, we end up stress eating. A lot of stress eating becomes sugar or the bad stuff. And then we feel guilty, and then there is a mood swing, and then people think it's their thyroid, and then they end up with a TSH, and they're getting obese, and that obesity is leading to a TSH of 5.5, which they think it's a thyroid, which is not. It is sort of maybe an extension of the metabolic syndrome we see today. And when we fix the weight, the PCOD vanishes, the metabolic syndrome reverses, the TSH normalizes. So we're just looking at it like, from little bits and pieces from here and there. We're not looking at the whole picture as, the whole system together.
No, that's so well, and I'm glad you brought up the thyroid into this, because yes, it is a cascade of things that we connect, and endocrinology seems so complex for us, and you simplify it down for us. So maybe can you tell us what are the factors that really affect thyroid? What are the symptoms a person could see, and what are showing up because of other metabolic syndromes?
See, I think, Poshni, this is where I sort of digress from my colleagues, the other endocrinologists. And I think there are things that everybody is starting to agree, that everybody knows a TSH of 5.5 is not the reason for mood swings, not the reason for anger, not the reason for weight gain. All the endocrinologists know that. But what most people end up doing, because everybody is short of time, is that they tell the patient it's not that. They know that there is some other emotional well-being issue and stuff. Either they sometimes refer to the psychiatrist, sometimes they prescribe something, but that is not going to solve the problem. Now, if I was to walk on the street and ask anybody, are you sleeping okay? Are you tired all the time? Are you feeling exhausted? Is your hair falling out? Are you just drained all the time? I would say probably 70 to 80% of India would say yes.
Yes.
Do all of them have thyroid? Then clearly we are missing something.
Yes.
We're not understanding that this is a lack of emotional and mental well-being. And a lot of that, again, coming from my own qualitative research, which is why I find it so hard to get it published, because I cannot quantitate many of these things. These are case stories. Some of these are really personal case stories, which I cannot put out in the world either, because they've been shared with me in the privacy of my OPD. And this is why it's very hard to share this data with the world, because and the question is, like I was talking to my friend, science talks about reproducibility. Now the question is, to be reproducible, somebody else needs to have those skills which I've had to develop, which is compassionate inquiry, active listening skills. And if anybody does that, they'll be able to get the same results, and it doesn't need me to be even a doctor. And once we start unpacking that, we realize so much of this comes to bad relationships, be it with parents, be it with spouses, be it with siblings, be it at workplaces, be it with colleagues, leaders, and this constantly being triggered just fuzzes your brain. People talk about having memory loss, people having brain fog. Every time I'm triggered, I feel all that. So a lot of understanding patients has come from understanding my own mind. And the more I understand myself, I'm able to hopefully sort of reproduce what works for me for others. And what I have learned is being honest and accepting your feelings and not running away from them and not distracting yourself from the discomfort of the uncomfortable feelings, not being toxically positive all the time. Be okay to be not okay. Sharing with your friends, your family, that this is what I'm going through, are really the best ways. And you'll realize it's like the weather. Our moods are like the weather. It comes on, the faster you rain and process it, but it becomes sunny again.
I love that. Example, or the way you connected it to weather, because until it rains, it's not going to get sunny. So, so while you're looking at all of these things working, because you have the perception, you have that compassion to see and understand what is going on beyond the clinical correlating factors that you see up in papers. how do you go about telling your patients that, it's probably sugar and carbohydrate addiction? What are the hacks you give them? How do you train them, or how do you teach them?
See, I think I don't like to use the word addiction much.
Okay.
I'll tell you why. Because addiction actually hurts people.
Right.
The word addiction, and I think we make the mistake. Beat any addiction.
Mm.
This is where I come across Dr. Gabermate's work in terms of trauma. And see, emotional pain is what people are trying to numb, okay, with different kinds of addictions. It could be a Netflix binge, it could be a shopping binge, it could be a sugar binge, it could be an alcohol binge, it could be a drug addiction, it could be anything. I mean, sometimes even work is an addiction because you're trying to distract yourself from the fact that when you go back home, your relationship sucks.
Yes.
So you drown yourself in work.
Yes.
And these all have ramifications. The addiction is because deep down, you don't feel good about yourself.
Yes.
Without addressing why you're not feeling good about yourself, which may need you to upskill, find your own worth. And that's where a good parent comes in. And the lack of which is why we are seeing a huge explosion of coaching industry, be it life coaches, be it relationship coaches, dating coaches, leadership coach, every kind of coach that, I mean, we have metabolic coaches. So the question is, because fundamentally we've been given a very bad software up here, which has been totally corrupted by, the voices we have internalized growing up. We have not heard enough encouraging voices that say, you got it, I'm there behind you, go ahead. And
Yeah.
we invariably, Indian parents tend to do two things. They either are too controlling,
Yes.
or they tend to be overprotective. Oh, don't do that, don't do this, don't do that. Or, no, you're not going to do this because I said so. So these two things take away any bit of self-confidence. So the people are constantly looking for validation.
Yes.
And in their relationships, they end up in, even if they do end up in a love marriage, they end up in a dysfunctional love marriage. That zaps whatever remaining hope they had. Once they're in a relationship, it's very hard to get out of a relationship. It's very easy to get in, very hard to get out. And they get trapped. If they have kids, then they're worse off. And so it's I wish this was as simple as, so now when you step back and tell patients, you know what, I see your pain, you're in bloody hell. That's when they see what they were going through. Yes. And a lot of people just sob hysterically in my OPD. And very often, many don't need a psychiatrist. They just need somebody to tell them that they were hurting and they were right to hurt. Yes. And once they start seeing that, they start putting the things into place. Because once you get that fog out, suddenly everything, the bulbs start, going on, and you make the connection. So I just help them find their own fire, so to say. And that's my easiest fix, so to say.
That's it brings to another question. I mean, the moment you started saying that, you address this in your with your patients. I have a two-part question again for you. One is, how can more doctors be like this? Because understanding that there are hundreds of people in the OPD waiting for them, I really believe doctors do not have the time because of the overwhelming number of people that they need to see on a daily basis. How can somebody be more compassionate or get to these aspects with their patient? And what is a leaving message that you leave behind for the audience?
Yeah, I think, Poshni, this is something, while I gave a talk yesterday, I was talking about an interesting case at one of our endocrine meetings. That's where I'm at right now. And the whole point is, one of the doctors asked me, how do we build for compassionate listening? Yes. Because until that happens, nobody is going to do it. Yes. It's just that the incentives are not aligned. Because if I can tell you, as an endocrinologist, to be honest, where I practice, my consultation fee is 200 rupees. Yes. So, but I do what I do because I am passionate about what I do. but that means I still have to be practical, and it's a tough balance. And that's why I write on social media, so that in the least, if somebody benefits from this, so be it. I'm sort of sharing my learnings as I go. But if every doctor is going to be valued on how many patients did they see a day, what is the pharmacy bill that they racked up, what is the number of investigations that they racked up, and how many inpatients did they admit, then I think you're never going to get the kind of care you want. And unfortunately, corporate India is about that.
Yes.
And I think there are a lot of doctors who want to break free from this, but they're stuck by a system which will silence their voice, which will throw them out, because they are starting to rebel, and rebels are never good for society.
I do have another question on this. How are you going about it? Because you are being really vocal. And how do you manage? Because I'm sure all of
Not
this
easy.
adds on a stress level for you, because you're being the listener there. How do you
So
manage?
I see, what I've realized is, see, I think, Poshni, it's been a big learning curve for me. 5 years ago, when I would listen, I'm an empath. I would just absorb like a sponge, and I'd feel heavy, really heavy, because I've been trained as a doctor to think that I need to fix things.
Yes.
And that was the stupidest mistake I made. But gradually over time, I realized, as a doctor or as anybody, as a friend, as a parent, I do not need to solve another person's problem. I just need to give them the emotional space for them to hear themselves out.
Yeah.
And maybe, if I don't get too involved, which has taken me a lot of effort, I can just show them, where they're going wrong in their thinking, which is effectively what cognitive behavior therapy is about.
Yes.
I can tell them, look, this is where you're screwing yourself up. This thought right here, erase and change and reframe that and make it a more empowering thought. And the minute you start learning to reframe, you get your power back.
Yes.
And I think that is where now, so then that becomes compassion from empathy. Empathy is draining. I have to feel what they're feeling. Yes. There are times I missed up when I'm speaking to patients. I may go around, sometimes it's young kids. I go up and they have nobody to speak to, not their parents, not friends. And I just give them a hug till they're finished sobbing. Yeah. And that's sometimes enough. I mean, it's not medicine, but oxytocin helps. That's a great hormone.
All right. Since we are less than 2 minutes before closing, sure. What is the message you'd like to leave our audience with?
I think medical science is evolving. We are learning, but we have to be open to learning. We have to be able to think critically. We need time to be able to step back, look at the big picture. We can't if we are constantly rushed. If we take textbooks as, the Bible, and I think that's the mistake many people do. We have been taught to be good students, and we by heart a bunch of things, memorize a bunch of things. We just think that this is, but they do not understand that these books were written at a time when we didn't understand many of the things we do now. And if we don't keep ourselves open, question, we would never improvise, learn to do better. Sometimes why I'm on Twitter is I'm among an interdisciplinary team. When I'm as an endocrinologist, I go to a meeting, all I hear is sort of my siloed boxes. And I want to hear patient perspectives. I want to hear the psychiatrist. I want to hear the cardiologist. I want to hear the neurologist. I want to hear, the dermatologist. I want to hear everybody's perspective so that I can form my more well-rounded perspective. That's how I would like to think of it.
Thank you so much, Dr. Sona. We have Shashikant here as well, who would like to talk to you for a few minutes.
Less than a minute, Dr. Sona, thank you for agreeing to come in this session and share your wisdom. We are all your fans in Twitter X. So much wisdom you are sharing, and it is diverse. It is not stuck to only one. You are covering it. It appears to be a solid holistic one. And we will want your participation in future conferences. We will give you bigger
Sure.
time to really speak. And we are so happy, and I wanted to thank you on behalf of Metabolic Health Conference, as well as on behalf of D-Life and Anup Singh. So I'll see you again. Thank you very much.
Thank you, Shashi. I think you're an amazing coordinator. I think it's your nature which makes it very easy for people to feel comfortable around you. And I think that's something very special about you. So it's been a joy working with you guys.
And we gave you your favorite host, Poshini.
Agreed.